Hello, my name is Bryce. This is my channel, Striving Intellect, and this is a good story. Let's get into it. So, this is a story that I think a lot of people will have a personal connection to, but it is a feel-good story. So, let's get started. Man sees deadly brain tumor shrink by half thanks to new radioactive therapy. And this is actually on Ground News. It will show you a large amount of different statistics, different leanings. I love this site. I'm not sponsored, by the way. But it actually connects you to a couple different sites, and I'll go over some different articles after I read this part right here. A man with a brain tumor has experienced a 50% reduction in size due to new radioactive therapy being tested in clinical trial. This trial, conducted by doctors at University College London Hospital NHS Foundation Trust, targets glioblastoma, which is often fatal in 18 months. Paul Reed, age 62, and I think that age is a big variable right there, is the first patient in this trial, showing positive results that experts hoped will lead to a cure. So we're going to go over to don't know what site this is. This is yeah, I can't read that. A man has seen his deadly brain tumor shrink by half thanks to a new radioactive therapy, which experts hope will eradicate the disease. Doctors at a university college in London, we already went over that. Around 3,200 people are diagnosed every year with this disease, which is the most common type of brain tumor in adults. It kills most patients within 18 months, and only 5% live for 5 years. That's pretty bad percentage, honestly. The researchers aim to cure the disease through injecting low levels of radioactive activity directly into the tumor to kill off cancer cells. Paul Reed has seen his deadly brain tumor shrink by half thanks to a new radioactive therapy, which experts hope will eradicate the disease. We already read that. The 62-year-old engineer from Luton in England is the first patient to take part in a trial that has seen his tumor shrink by half in a matter of weeks. For the procedure, surgeons remove as much tumor as possible before implanting a small medical device called an Omea reservoir under the scalp, which connects to the tumor via small tube. Paul Reed, a 62-year-old engineer from Luton, is the first patient to take part in the trial and has seen his tumor shrink by half in a matter of weeks. A second patient has also started the therapy. For the procedure, surgeons remove, this is all rehashing. The nuclear medicine team at UCLH then injects drug ATT-001 in iodine 123 label PARP inhibitor directly into the tumor, delivering small amounts of radioactivity. The drug, which is given weekly for 4 to 6 weeks, is very potent over short distances, causing lethal damage to tumor cells while sparing healthy tissue. Mr. Reed, who has reoccurrent glioblastoma, first noticed a very severe headache last December that would not shift. After being diagnosed and undergoing surgery 2 days after Christmas to remove as much of the tumor as possible, Mr. Reed had follow-up courses of radiotherapy and chemotherapy. But doctors told him in July that his tumor was growing again. That would be the reoccurring portion of the reoccurring glioblastoma. Mr. Reed was then offered a place in a new Citadel 123 trial at UCLH, having previously agreed to take part in clinical research. He said, "I was fully expecting the tumor to return due to its aggressive nature. I know the outcome isn't great, and I was happy to explore anything else," which I think a lot of us probably might try something like that, given the percentage survival rate. This trial was a lifeline, as the likelihood of survival, according to the data, has a year or less for me. I am delighted to be given an opportunity to be part of this trial. I have not experienced any side effects from the injections. So we're going to switch to Sky News. Love it or hate it, they covered this. There's a picture of Mr. Reed right there. It looks like they inserted their device that injects radioactivity directly into the tumor cells, or as close as possible. Let's see. Yeah, this is basically the same thing. So we're going to switch over to the Institute for Cancer Research. This seems like a very credible source. This might get into the weeds a little bit. This might be a little bit in depth. And it looks like this is actually image PET scans of the glioblastoma patient's brain 72 hours after the injection with the radio tracer. A new imaging technique could mean patients with aggressive brain tumors benefit from cutting-edge immunotherapy treatments, according to researchers. A team from the Institute of Cancer Research in London has developed a new immuno-PET imaging technique that could spot which glioblastoma patients would respond well to immunotherapy and track the response over time. Brain biopsies come with risk of infection and bleeding. So I guess this new imaging technique will actually allow them to avoid those side effects. Glioblastoma is a type of brain tumor with a very poor prognosis, with an average survival of 12 to 18 months. Only a 5% of patients survive beyond 5 years. We've already gone over this. Research indicates that certain patients, especially those with aggressive tumors, may respond well to immunotherapy drugs, but there is currently no way to assess it without a tumor biopsy. Due to the risk of infection and bleeding, Biopsies are rarely carried out on glioblastoma prior to the surgery to remove the tumor, meaning these patients are missing out on improved treatments. Those with higher levels of PD-L1 might respond to immunotherapy. Higher levels of PD-L1 protein have been found to in the rapidly progressing glioblastoma tumors. This protein acts as the brakes on the body's immune system. So targeting the PD-L1 and blocking its function could kickstart the immune system into fighting the cancer. Until now, the biopsy has been the only way to assess the levels of PD-L1 in the brain tumor. However, a biopsy gives a static snapshot of the protein level of the tumor and its environment at the time of it was taken. There is also a time lag between taking biopsy and making treatment decisions, by which time protein levels may have changed. Due to the changes in assessing PD-L1 levels, and therefore whether the immunotherapy would work. Without biopsy, patients with newly diagnosed primary brain tumors are regularly excluded from early phase clinical trials. So this new mapping technique will allow individuals to get into these clinical trials because they can see the levels of PD-L1 before they do a biopsy, it seems. The research team funded by the Institute of Cancer Research, which is a charity as well as a research institute, developed a radio tracer, a radio molecule attached to a radio molecule attached to an antibody to bind to the PD-L1 protein, then measure the levels in the body of a patient with glioblastoma. In findings published in the journal Oncology, the researchers tested their radio tracer to see how well it would bind to the PD-L1 protein on the tumor and immune cells and show up in the PET scan. A clinical phase was conducted in a collaboration with the Medical University of Silesia in Poland, and looks like a National Research Institute also in Poland. Sorry, I didn't try to pronounce those. I would butcher them. Funded by the Medical Research Agency in Warsaw, Poland. The tracer binds to the PD-L1 8 newly diagnosed glioblastoma patients were given the tracer intravenously, followed by a PET scan after 48 and 72 hours. Their PET scans show that the tracer successfully binds to the protein, the PD-L1 positive cells within the tumor and throughout the body. These results were captured in biopsies taken during surgery and to remove the tumor after the PET scan. 5 of the patients were randomly allocated to also receive pembrolizumab before surgery, which is a monoclonal antibody that blocks the function of said protein PD-L1 by targeting a protein it interacts with called PD-1. The researchers saw that these patients had lower levels of the tracer in their tumors, suggesting that the drug is acting on the PD-L1 protein and removing the brakes from the immune system so it can fight the cancer, which is a good thing. They also saw that these patients had higher levels of the tracers in the lymph tissue, indicating that the drug was activating the immune cells around the body. 3 of these 5 patients have seen cancer stabilize and not grow any further. The researchers will be investigating the connection between their response to the drug and the levels of PD-L1 in their tumor before treatment. The clinical trials aim to recruit 36 patients diagnosed with glioblastoma to evaluate whether pembrolizumab, sorry, I probably butchered that, the drug given before surgery is effective, whether PET imaging using the radio tracers can be used to monitor progress and adjust treatment as needed. The researchers also develop another radio tracer that they believe will be even more effective than the antibody used in the study. The molecule is smaller and so passes through the blood-brain barrier, the toxin-preventing membrane that protects the brain more easily, meaning the PET scan could be taken just 1 hour after the injection. The team hopes to test this molecule in similar studies in the future. So, in theory, the sooner the better. The sooner they can see the effect of this, the better. A personalized treatment plan. Dr. Gabriela Kramer-Marek, probably butchered that, associate professor and group leader of the preclinical molecular imaging at the Institute of Cancer Research in London, said, "This study could revolutionize glioblastoma treatment, as we've shown that that it is a possibility to image an immunotherapy target with our radio tracers, being able to take a scan of the patient's body and see the levels of this target means that we can predict the patient's response, see their immune system responding to the treatment, and after treatment where necessary, provide a personalized treatment plan based on unique characteristics of their tumor, all without needing for a pre-surgery biopsy, which what we learned earlier could lead to infection or bleeding. I look forward to seeing the result of our larger clinical trial to assess how effective this immunotherapy is in glioblastoma patients. I hope that our radio tracer will tell us more about the biology behind why some tumors are more responsive than others. A paradigm shift in terms of how clinical decisions are made." Professor Christian Helen, CEO of the Institute of Cancer Research in London, said, "Glioblastoma is a devastating disease, and treatment haven't been significantly changed for decades. Although immunotherapies seem like they might have been might be effective, progress has been stalled by not having biomarker tests to show who might benefit from them or way to monitor other patients' response to the treatment. These challenges mean that the patient's newly diagnosed brain cancers are often excluded from early phase trial. It might be the reason that so many brain cancer clinical trials are unsuccessful. It's fantastic to see the advances in technology. That means that innovative imaging techniques could soon guide personalized treatments. This research could be part of a paradigm shift in terms of how clinical decisions for glioblastoma patients are made, from selecting patients for clinical trials to monitoring a response to the treatments in real time. So now I'm just going to go over some statistics real quick. These are actually statistics for the United States. Seeing that these individuals are in the UK, I thought I would actually look at some stats from the US. And this is actually overall death stats for a multitude of different cancers. But what we're going to do is we're actually going to compare the different cancers and how deadly they actually are. And let's take a look. Okay, so brain and other nervous system cancers. Rate of new cases and deaths per 100,000. The rate of new cases and deaths of brain cancer and other nervous system cancers was 6.2% per 100,000 men and women per year. Death rate was, so that looks like So let's take a look at this list. This is a list of the common cancers in a comparison of death rates comparatively to cases. So if you see the top, looks like breast cancer for females, which has a very high percentage death rate. Prostate cancer, lung, so all the way down here, and this looks like is actually a very broad category, is brain cancer. So it's a rare cancer. But as you can see, 25,400 people get it a year, and the estimated death rate out of the 25,000 would be 18,760. So that is a very, very high mortality rate. And as you can see right here, I actually brought up the Hoffitt Cancer Center brain tumor survival rates. This one is specifically just about brain cancers. As you can see, there's a couple different types listed right here. And let's see what it says. Brain tumor survival rate depends primarily on the type of cancer that the patient was diagnosed with, has been diagnosed with. Some types of brain cancer, such as meningioma, ependymoma, and oligodendroglioma, that one was hard, are highly treatable, while others may be less responsive to curative therapies. While the type of cancer, such as CNS lymphoma or medulloblastoma, is one of the most important factors in determining the overall survival rate. Other details also have an impact. Younger patients tend to have more favorable survival rates than patients who develop brain cancer later in life. And patients who are diagnosed with lower grade tumors often have better outcomes than patients with higher grade malignancies. What are the survival rates for brain cancer? The survival rate for brain cancer are widely depending upon the type of tumor and the age of the patient. Here are some basic survival rate statistics as reported by the American Cancer Society. And so it looks like oligodendroglioma, 90% for patients under 22, or from 22 to 44, 82% of patients for 45 to 54, and 69% of patients from 55 to 64. So it does get much less likely for you to survive the older that you get. Meningioma, 84% of patients 20 to 44, 79% of patients survive from 45 to 54, and 74% of patients from 55 to 64. And here is glioblastoma. This is the one we were talking about. Oof, that is bad. Yeesh. 22% of patients from 22 to 44 survive. 9% of patients from 45 to 54 survive, and 6% of patients from 55 to 64. So this would be the category that Mr. Reed would fall under. And that is, a very good sign that if his tumor is getting smaller, then hopefully it will bring up this percentage rate for individuals of that age, or actually all ages. And hopefully this treatment and imaging technology can be used on many different types of brain cancer. And it looks like ependymoma / anaplastic ependymoma. I probably didn't pronounce that one right. 92% of patients from 20 to 44 survive. 90% of patients from 45 to 54, and 87% from 55 to 64. And it looks like, not that you want to get a brain tumor or cancer, but if you do get a type of brain cancer, this is probably the easiest to survive. And hopefully these rates go up. That would be amazing. Absolutely. And lastly, but not least, anaplastic astrocytoma has a 58% survival rate from age 20 to 44, 29% survival rate from age 45 to 54, and 15% survival rate from age 55 to 64. And that drops off very quickly as you get older, it looks like, for that one. And although survival rates can be informative for patients who want to know more about their possible prognosis, these are broad statistics. These broad statistics aren't truly indicative of any one person's projected outcome. That's because general survival rates are based on data collected from large populations of people, don't take into account personal factors such as patients' unique response to treatment, I assume age, your health, how healthy you are, whether you exercise, your diet, so on and so forth, and are based on data from patients who entered treatments at least 5 years ago. As a result, they do not account for advancements in research and treatment that have occurred since that time. So the treatment that we just spoke about, this one would not actually be counted in these statistics. But there you have it. I really wanted to highlight this story. I think it's a really positive story. It reduced his size of his tumor by 50% within weeks. This is massive. So, many of us have been affected by cancer, whether or not it's a family member, ourselves, friends. So it's something that touches basically everybody, and I think this is a very, very positive story. And I think any medical technology that is going to improve the survival rates of individuals with cancer of any type, hopefully this type of treatment can be expanded, and maybe someday there will be a complete cure. Maybe someday we will be able to get rid of this ailment. But I just wanted everybody to see this. I hope this wasn't too rambly. Please excuse my mispronunciations. This is something that I'm not necessarily used to talking about, so I really appreciate your guys' time. Please like and subscribe, and have a wonderful day.